Well, this is super cool. I'm with the dream team of pain management experts, Dr. Smith, Mike, our physician assistant, Dr. Stahl. It's great to see you boys. How we doing?
Good.
I'm good. I'm very good.
Let's just go down the row here. Each of you tell us what your favorite thing to teach, your favorite part of the program to teach here as Empire Medical Training.
So for me, it's PRP, which is the ACP biologics class. I do PRP in my office. It's probably in my opinion, one of the greatest medical discoveries in my lifetime. As far as being able to take the patient's blood, spin it down, create a platelet-rich plasma, and inject it into damaged tissue, and it heals. To me, it's phenomenal. I can't do it enough in my practice, and when I'm teaching it, I do everything but a dance when I'm up there talking about it. So that's probably my favorite thing. And the manipulation class that I wrote.
I would say the joint injection class, simply because I love doing them, and I've been doing them for 20 plus years, and I know patients can do really well with that. I also have instituted the PRP joint injections into my practice, and that has gone extremely well. I'm very excited about PRP as well.
I would have to say probably my favorite class is the Perineural Injection Therapy class, which I wrote and developed for Empire. It's a really high benefit, low risk, low cost way to get into regenerative medicine. But I also revamped the curriculum for the Pain Show, our 3-day comprehensive training. I enjoy teaching that as well. I just love getting so many students from so many backgrounds coming with so many needs and wants, and being able to address them all in one comprehensive training.
So let's follow up on that. I'll ask each of you this, whoever wants to jump in first. From a student perspective, when they come and they sit with each of you and they learn these things, how is the experience, you think, for them to be able to just get, a hose, like a water hose of information? There's so much that you guys are teaching them.
I think it's great training in the sense that whatever questions you bring with you, we will have the opportunity to answer it and help you work through it. I do think that there's a lot of training, so it really behooves us to be well organized. One of the things we've all been working on over the last few years is to improve the organization and the outline of the curriculum, just to make sure it's as accessible as possible to the students.
I think, being that I was a student here as well through Empire, I like that you're able to get a lot of one-on-one attention with the students are able to get a lot of one-on-one attention with us as instructors. So that we could spend time with them and show them the right way, let them get some hands-on training and feel things, because, there's nothing like really putting your hands on something and feeling it and doing it. That's probably, for me, that's the easiest way to learn. And I hope that the students find that helpful for them as well.
And Dr. Smith, you have a unique perspective because you've been with Empire for a long time. 2017, I believe?
Yes. I took my first class at Empire, which was the Pain Show, in 2016. And when I first, and you were talking about the water, it is like drinking from a fire hose the first time you do it. And I went to that program. I really enjoyed it. I connected with one of the instructors who was a longtime pain guy with Empire. And in those days, the memberships were different. There were only 2, I think. And so I took the Pain Show. I came back and took it a second time. And that's when the instructor asked if he could come to my office. We were in Las Vegas, and I helped him out. And then he asked me to help teach the class the next time they did it. And that's how I got started way back then. But one of the things that I like to do when I present this, that I found when I took the class, is that primary care providers, when we say pain management, it's almost like it was the wizard behind the curtain. But we kind of pull the curtain back a little bit and say, look, there are things in that realm that you can do in your office. Keep the patient at home, keep them in your clinic, generate that revenue for your business, and when things get to the next level that you need, then refer them out. We teach how to do that. Who do you send this patient to? Do all the things you can do for them, and then send them out. Because when a patient comes in and they're in pain, the most important thing to do is do something. Do something. And so we're teaching that kind of thing. Do something for them today, and then help them, and then get them where they need to be later if necessary, but do something for them.
From a patient perspective, that is like music to our ears, right? To be able to walk in and have somebody say, I get it, you're hurting. Let's fix this now.
Let's do something.
Yeah.
Like, we actually had some students this weekend who provide care in a long-term acute care facility and some skilled nursing facilities. And one of the reasons they came here is logistically, when a patient is dealing with kind of chronic issues, chronic mobility issues, and is living in a facility, logistically it can sometimes be challenging to either get a specialist to come see them in their facility or get them transported via ambulance or what have you to a specialist office. So they want to start bringing these services into the facility to treat an underserved population and up their game and provide a better standard of care. The fact that we can empower people to do that in their practice is really a satisfying thing to hear.
Yeah, and then so to that point, what types of practitioners would you recommend come to take the pain management classes?
Anyone can come. We don't really exclude people because no matter where you are, we can meet you where you are. We can help you to achieve your goals. So if you want to just do a few office-based injections because it's point of care and you'd like to up your game there, that's fine. If you want to learn how to do an ultrasound-guided injection into a deeper joint or a deeper tissue, we can teach you that. In fact, we're teaching that today. And if you want to learn how to do a fluoroscopically guided spinal procedure, we do have that comprehensive level of training. So no matter where you're starting and where you want to wind up, we will find out where you are, meet you where you are, and try and take you to where you want to go as best we can.
Now, I would imagine that because medicine is continually evolving, you all are continuing to, you're all experts already, but you still got to learn new stuff, and then that means the curriculum is ever changing and is fluid as well, right, guys?
Yeah, definitely. PRP really it's been around for, probably 15 or 20 years, but it has really significantly evolved into something that's been hugely beneficial for a lot of people. I'm always reading, listening to different articles or presentations on some newer topics in pain or orthopedics or in, some subjects like that. To keep up with what's going on and what the new studies are showing.
So if people are watching and they're thinking about taking some of these pain management classes, what's a good way for them to start?
So I think the best way to get in and get a feel for what pain management is, and essentially what we're teaching in pain management is interventions, teaching things you can do for people. So the joint injection class, it's a non-spinal joint injection class, is a good way to start. So you come in, you learn how to do hips, knees, shoulders, predominantly some trigger point injections, and you learn the basics there. And then the next program would then probably be the pain show, which is 3 days, and it covers ultrasound guided, it covers soft tissue, it covers some rehab, and we have a cadaver with a fluoroscope where we actually do procedures on the cadaver, and it's 3 days. And then you can take if you want more information on PRP, you take the ACP biologics. If you want more hands-on with ultrasound guided, then you take that class. Then we have the Perineural Injection Therapy, which is another level of neuropathy treatment. And then we have the manipulation class. So you want to add that to your practice. It's a way of rounding it out. And the best way through there is the pain management membership, which includes the American Association of Procedural Medicine board certification. After you take a certain number of classes, you take a test, you present case studies, and you get a board certification that gives you the ability to say, I do this work, and I've trained in this work, and I'm the best at this.
And that speaks to, I think, a big part of what makes Empire Medical Training so different is the diversity. Diversity of classes, diversity of instructors, and diversity of students.
Mm-hmm. Yeah. And I actually feel that one of the strengths of Empire is both the diversity of our students and the diversity of our faculty. I've been to trainings through other organizations, many of which are sponsored by, let's say, a professional association. So you'll go to some courses and all of the faculty are specialists who are board certified in the same primary board, and most of the students are specialists. In some cases, only physicians are allowed to attend. In some cases, only physician specialists are allowed to attend because they're selecting from a narrow range. When you come to a course from Empire, you'll have specialists, physicians, often leading the courses from a variety of backgrounds, but you'll also have nurse practitioners and PAs with experience in the profession as well, who are also injectors and have also worked with physician specialists, but in many cases also have experience in a primary care setting. And we can address the needs of people who aren't necessarily an MD or a DO who's already done a specialty residency and is maybe in a specialty fellowship or thinking about it, or is looking to just cross-train on something related to what they already do. We can really take people who are coming from a completely different place and introduce them to a new world.
And then just to kind of put an exclamation point on that, overall, given everything we just talked about, what would you say is the main differentiator, the main reason why people watching should enroll in this program, given everything that we've covered so far?
There's a couple of things. Part of it is the diversity I talked about. Circling back to the board certification that Dr. Smith had mentioned, we're not the only organization that will allow you to train for a certification in pain medicine, but unlike most, if not all of the others I'm familiar with, we require hands-on training. We require that you've actually done these procedures, at least in a training environment. We offer training on human cadavers as well as mannequins. And generally speaking, we require that you submit at least 2 case reports of your own patients as part of the board certification process, so we can verify you're actually doing it and review your work with you. A lot of other organizations, you take a weekend class and do a multiple choice exam and boom, here's your certificate. So I think if you have a certificate from the American Academy of Procedural Medicine combined with a screenshot of the actual requirements to get that certificate, that can go a long way to proving that you've done more than you had to get some credentials in this realm of endeavor.
I love that. Guys, anything you want to add to that?
I would say that if you're in primary care or you're in other areas and you want to add this to your practice, the best thing that we offer you is the ability to treat your patients the way they deserve to be treated and build your business the way you deserve to work.
The most important question is, because he's so new, are you guys hazing him at all? With the process?
Shamelessly and without mercy.
Thanks a lot, gentlemen. Appreciated the time.
All right, well, thank you.
Thank you.